Hi, Dr. Mike here. I wanted to go over how we approach TMJ disorder at Tangelo. It can often be very frustrating and it can wreak havoc on patients, but it's something we do well with, and we get pretty steady and pretty consistent and pretty optimal results that we're proud of here. So, this is one that we like to manage with your dentist, with your specialist. They're ruling out pathology. They'll be able to look at images, talk to you about the joint. Having the specialists rule out anything big, bad, scary, and look at the joint health itself is really important. That's going to allow us to do what we do, and do what we do well with a complete confidence and assurance that we can make some changes. But typically there'll be an image. They're going to look at the joint. You can see the nerves into that area. But once you kind of rule out any type of structural pathology, now you're in our space where we're talking about muscles and tendons and joints and offloading and stress distribution. That's kind of our bread and butter here. So one of the things we dive into once we evaluate the jaw and we rule out any pathology, it's overall mechanics of the shoulders and the neck. Okay, so when we're talking about neck, looking at upper, middle, and lower trap mechanics. A lot of times we're bent over, we're forward. That's fine. We just want to be able to be comfortable there and have other options, so it's not the same stress distribution into the jaw, right? So if I'm in this position and I'm leaning forward, I'll start using muscles that put tension into that area. Okay, so it's kind of both a local, regional, global approach to offload stress into the joint itself, right? Then it's tendon management and movement. I'm going to be looking at upper trap, lower trap, middle trap mechanics, which is a pulling, pressing mechanic, right? If I have perfect posture, but I'm reaching forward to get there and all that stress and I'm grinding into that position, that joint's going to continue to have a lot of stress. So we got to show your body where to go. We're going to clean up some pulling mechanics and some pressing mechanics. How do I get into this upper trap and create balance with the middle back, with your chest? Because if I get pulled forward, what we typically see is these structures into the neck, this the SCM muscle, your scalenes, they start putting more and more pressure right into that joint complex. And if these guys are inflamed, if these guys are irritated because they're overuse or they're doing all the work, let's calm them down and get some help involved. Okay. Other structures when we're in that forward position, these are the main guys that you may have even heard your specialist talk to you about. Or if you're working through this is where you're going to get your masseter, your chewing muscle, your temporalis muscles. You can even get headaches in there, right? At which you can see if those guys are tight and doing all the work, it actually creates some compressive forces. I can't open up. And just like you can see, this is a muscle and tendon. You can get tendon inflammation. That also creates congestion and pressure. That can irritate the joint, that can irritate the nerve, that can cause symptoms. So here we are in this cycle now where if we have some stress and we're moving into that stress, we can rub here all day long, calm things down, but then we have to pair that with different types of mechanics and different types of movements to offload those same structures, putting the same stress in that same area. So that's where, again, we want to get out of these neck muscles. We want to integrate big, broad shoulder mechanics. So oftentimes when I see people suffering with grinding and TMJ stress, and we've ruled out pathology, there is a heavy, heavy emphasis on movement at a local level and then a global level. So we can, over time, offload structures, build up those structures' capacity, and have different types of movements so we can get out of that joint and distribute stress differently. This is one that we love to see. Early on, it's hard because that patient's dealing with a lot of pain and a lot of discomfort, and they've been usually dealing with it for a very long time. And then we're really excited because eventually over time, they start to get relief. They start to get better. Tissues start to change. Tissues start to heal. They get less sensitive. And all of a sudden, I'm moving in ways where these structures can start to feel better. And I have other strategies so it's not the same pressure into that joint, which is basically the point we're trying to drive home. The other side of this, when we look globally, sometimes we get that upper trap levator. It can even refer pain. It can cause headaches. So this is why it's really important. There's kind of a myriad of symptoms that come up with this. So if we can get a little bit of an edge and get things moving in the right direction, it makes a huge difference for people, especially when they've done all the right things and nothing seems to be working, or they're looking for that next push. So if you're experiencing this, don't hesitate to talk to your doc about it. If you specialize in treating this, this is how we typically approach it at Tangelo. So happy to connect on that point. But something you don't always think about when you think about a chiropractor or a rehab office, but this is something that we see often and we do really, really well with. So wish you the best. I'll talk to you soon.